All right, so welcome to another edition of Fitness Facts. Dr. Taylor here again. We're going to talk about food and supplement sources of protein. So an overview, where we're going, what we're going to be discussing. So food sources, you can break food down into, does it contain complete or incomplete proteins? And I'll explain what the difference is here in a bit. Also, we need to talk about protein quality, protein types, and supplements. So we're going to discuss collagen, dairy proteins, which include casein and whey protein. I'll also talk about soy protein and then whole food protein. So with food sources, remember that protein-containing foods, and again, you saw there on that intro slide some examples. You look at tuna and chicken and eggs, any type of meat, seafood. These are going to be your high-protein food sources. They're comprised of, the proteins in those foods are comprised of amino acids, and I talked about this in another video. But remember that of the amino acids, of the 20 amino acids, 9 are essential, which means they're essential to our body's function, and we have to get them from the food. We have to get them from our diet. 11 of the 20 are considered non-essential amino acids. Those amino acids we can produce endogenously within the body. All right, so foods can be grouped into two categories. Those foods that are considered to contain complete proteins. And a complete protein just means that all 9 essential amino acids are present. So complete proteins, any animal product that you consume, and also soy, animal proteins, whether it's a glass of milk, a steak, maybe some salmon, doesn't matter. If it comes from an animal, it's going to have all 9 essential amino acids. Therefore, it's a complete protein. And these are also known as high-quality proteins, anything from animal or soy. Incomplete proteins, these do not contain all 9 essential amino acids, and these are plant-based, okay? So these are also known as low-quality proteins, and we'll dive into this further here in a bit. So protein quality, this is important to understand, and we've got to talk about digestibility. So proteins must be digested from the food we eat before they can provide the free amino acids that those proteins are comprised of to the bloodstream, and then eventually those amino acids make their way into our different cells, the cells of our organs, our muscle cells, etc. Protein digestibility depends on the protein source. Where is it coming from? Is it an animal source? Is it a plant source protein? And other foods that are eaten with it. Right? For instance, typically if you eat protein with some fat, that fat's going to slow the digestion and absorption of the protein and the amino acids entering into the blood. Versus if you just had, say, a whey protein shake, which is just whey protein isolate, is primarily just pure protein, and nothing else is consumed with it, that whey protein gets digested and absorbed very rapidly. I mean, within 20, 30 minutes, you're going to see amino acid levels rising in the blood, okay? So what you consume with the protein is going to affect digestion and absorption rates. Also, the type of protein, again, digestibility of animal proteins is very high. Most plant proteins are less digestible. And a little bit higher there, the digestibility for soy and other legumes. So how is protein quality measured? Well, there's really 2 different ways. An older method is the protein digestibility corrected amino acid score, PDCAAS. That's related to the quantity, the amino acid profile of specific amino acids that a food or supplement contains, and also the digestibility of that protein source. So the way this is assessed, it relies on post-digestion and fecal excretion, so measurements of amino acids in feces, to assess amino acid absorption indirectly. So you're not necessarily assessing directly what's absorbed, but kind of what's excreted, right? And then you can determine, well, based on what's excreted and you know what was consumed, the difference then would maybe be what was absorbed, although some of it may have been broken down by bacteria. There could be other things that didn't allow for all that absorption. This is a less, I would say, accurate method of determining protein absorption because it's measured indirectly versus the digestibility indispensable amino acid score, the DIAAS. This is a more accurate way of assessing absorption of amino acids from the small intestine and overall protein quality, because again, you're directly measuring here and quantifying the amino acids being absorbed from the small intestine into the blood. So for both measures of protein quality, though, a higher score reflects greater protein quality. Okay, and so this is important to consider the protein quality when choosing protein sources, especially for athletes, elderly individuals that a lot of times don't take in enough protein. It's important to consider protein quality and to consume protein from sources that have a high score. And here you see a table with the DIAAS percent scores for various food sources. So what scores high as far as quality of protein? These different food sources, if we look at them on the left-hand column, you see whole milk powder, really high, milk protein, whole milk, eggs, all of those in green, beef, whey protein isolate, chicken breast. Those are excellent, high-quality sources of protein, getting all those 9 essential amino acids that your body needs. Digestibility is great. So high score here, you're absorbing, again, all those essential amino acids that are so important to your cellular functions. You look at some in the middle there that are considered good in yellow: soy protein concentrate, whey protein concentrate, pea protein, soy protein, wheat proteins, chickpeas, and then the ones that are low on the DIAAS, so lower quality proteins, again, more of the, plant-based, so peas, rice, rye, barley, wheat, almonds, etc. So this study published in April of 2022 by Reed McCann and colleagues examined the effect of animal versus plant protein on muscle mass, muscle strength, physical performance, and sarcopenia in adults. Okay, and you might ask, well, what is sarcopenia? This is the age-related loss of muscle mass, right? So typically as you age, you see a loss in muscle mass, especially into the, once you get into the 50s, 60s, 70s, 80s, and beyond. In each decade, you're seeing more and more muscle loss. Now, obviously, if you're doing resistance training and you're taking in adequate protein, that can blunt or attenuate that loss of muscle mass, and it can help stave off this sarcopenia from setting in. So proteins also inherently differ in their quality, that is, their amino acid profile combined with their bioavailability. Proteins from animal food sources are referred to as high-quality proteins, as I mentioned previously, due to the presence of all 9 essential amino acids in high quantities, as well as the greater bioavailability of these essential amino acids. So it's just easier to digest and absorb them, get them from the gastrointestinal tract into the bloodstream. In comparison, plant proteins often have very little of one or several of the essential amino acids, so they can be missing some. For example, many legumes lack methionine, cysteine, and tryptophan. Plant proteins are also less bioavailable due to the structure of plant proteins and a high concentration of compounds found in that plant source that bind up the proteins. For example, tannins and phytic acid. They can bind up proteins, they basically make the protein and the amino acids less bioavailable, right? So it's more difficult to absorb those amino acids and get them from the GI tract into the bloodstream so that the amino acids can go onto the cells. A greater proportion of dietary fiber in plant protein food matrices is also expected to reduce protein digestibility. So again, this is an important difference in animal versus plant proteins, okay? So notes for vegetarians and vegans. It's very important that vegans, or if you're vegetarian, meet the body's essential amino acid needs by consuming a variety of different protein sources that will collectively have all the essential amino acids. So for instance, remember, you may eat one, maybe it's peas or a bowl of rice, and you're getting certain amino acids in the rice, but you're missing some. Peas, you may have a different amino acid profile, right? So it's important to combine a variety of different plant, vegetable, plant sources of protein throughout the day. So vegans can consume all the amino acids they need over the course of a day by eating a variety of whole grains, legumes, seeds, nuts, and vegetables. An example of this is going back to the rice. So if you eat rice alone, you're going to be missing, let's say brown rice, some essential amino acids. But if you combine that with beans, so you have rice and beans, because each has a different amino acid profile, when you combine them together, you'll be able to get all your essential amino acids, and combining rice with beans would then form a complete protein because all those essential amino acids would be present with that combination, okay? So remember, for a body cell to make proteins from amino acids, the cell must have all the needed amino acids available simultaneously. The liver can make non-essential amino acids that are in short supply. If an essential amino acid is missing, a cell must break down its own proteins to obtain whatever essential amino acid is needed to maybe synthesize another different type of protein in the cell when making a new protein strand. So here, just looking at animal versus plant protein, both animal protein sources and plant protein sources are capable of stimulating muscle protein synthesis, which is what most, athletes, bodybuilders, anybody that's training, they're going to be, this is important to them, right? If we look over on the right-hand side, most animal-based protein sources there, including dairy, meat, and eggs, as I've mentioned, are more digestible than plant proteins such as soy, wheat, rice, and potato. And as a general rule, the leucine content of animal proteins tends to be higher. It exceeds that of plant proteins. And in a previous video I did on protein and muscle protein synthesis and exercise, I talked about the importance of leucine, and leucine can stimulate a molecule that's inside cells called mTOR, and leucine, when it's in adequate amounts, it's theorized there may be this leucine threshold where you have to have a certain amount of leucine in the blood and a certain amount entering cells where it can help switch on mTOR, and that's going to stimulate and drive muscle protein synthesis. And then if you're resistance training, that's going to help to stimulate gains in muscle size, muscle growth, muscle hypertrophy. And leucine isn't the only amino acid that's important in stimulating muscle protein synthesis. I mean, the other amino acids are as well, but leucine in particular has an important role in stimulating that muscle protein synthesis. All right, so let's look now at protein types and supplements. So collagen supplementation. Okay, so in more recent years, you're seeing more about collagen supplementation and people using collagen supplements. Oral collagen, it contains an incomplete amino acid profile, so it's a poor source of amino acids, especially like all the essential ones compared to complete proteins. A downside with supplementing with collagen is it's not great for stimulating muscle protein synthesis, whereas if you look at like whey protein is excellent for stimulating muscle protein synthesis. So, if you're an athlete, you're somebody that's doing a lot of resistance training, to stimulate that whey or that muscle protein synthesis, say after a workout, whey protein is the way to go, I guess you could say. It's going to be the right source of protein there if you're not able to consume, say, a whole food meal after training. Collagen is thought to stimulate the body's natural synthesis of collagen, so this can be a benefit to collagen supplementation. I don't want to just totally knock it. Some evidence is available that suggests collagen supplementation may promote decreased joint pain. Again, you have collagen in the bones, the connective tissue, the tendons, the ligaments that are around joints. And so adding in some collagen through supplementing with it may have a benefit there with the joints on decreasing joint pain, improving mobility, and also it looks like it can benefit the skin since we have a lot of collagen protein in the skin along with the protein elastin. Having adequate collagen in the protein or adequate collagen protein in the skin can help improve skin elasticity, maybe help reduce aging. There needs to be more studies on this. But again, we know that as you age, the skin loses collagen and elastin protein, and that contributes to wrinkles and skin aging and just less elasticity overall. So, maybe collagen supplementation could be beneficial there. Again, I think there's a lack of research right now, a lack of human studies. There needs to be more research in this area. Food sources of collagen, if you're not taking it in a supplement form, great food sources include fish, poultry, meat, eggs, dairy, legumes, and soy. They may all support collagen production in the body because they are high in the amino acids needed to make collagen. And the specific amino acids that comprise collagen protein, glycine, proline, and hydroxyproline, right? So those amino acids are going to be high in those food sources, and that could, in theory, help your body to synthesize more collagen to support, tendons, ligaments, joints, skin, the health of those tissues overall. Also, you need adequate zinc, which you can consume that mineral if you're eating enough meat and nuts. You also need to intake an adequate amount of vitamin C, which you find in citrus fruits, things like oranges, lemons. So you need zinc and vitamin C to help with the synthesis of collagen. And then also those three amino acids in adequate amounts are important. So this study in 2020, published in the American Journal of Clinical Nutrition, the title here, Whey Protein but Not Collagen Peptides Stimulate Acute and Longer-Term Muscle Protein Synthesis with and without resistance exercise in healthy older women. This was a randomized controlled trial. So what were the conclusions of this study? This study showed that supplementation with whey protein, so that's WP there, elicited greater increases in both acute and longer-term muscle protein synthesis than collagen protein supplementation, which suggests that whey protein is a more effective supplement to support skeletal muscle retention in older women than is collagen protein or the collagen peptides. So again, this just kind of ties in with what I had bolded in bold print on that previous slide, where collagen supplementation doesn't appear to support muscle protein synthesis and overall, muscle as well as whey protein, okay? All right, so there are two main types of protein that are derived from milk. So now we're getting into talking about the dairy proteins and supplements that can be used here. So there's if you look at milk, 80% of it is comprised of the protein casein, all right? So this is one of the milk proteins. And then 20% of milk is comprised of whey, all right? And whey used to be thought of as a waste product, so a byproduct of the cheese manufacturing process. So remember, we actually make cheese from the milk. And they used to get rid of the whey. They thought it was a waste product. And then they found out, oh, wow, this is actually very beneficial to the human body. And now, whey protein is sold in a supplement form. Now, I'm not being paid by Optimum Nutrition or promoting them. This is just the whey protein that I take when I do supplement with it. So whey is very bioavailable, has a lot of benefits. It's available in 3 forms: whey protein concentrate, whey protein isolate, and whey protein hydrolysate. So let's look at these different types of whey protein. So they're on the first column on the left-hand side of this slide. You see whey protein isolate. And what does that mean? Well, whey protein isolate, the protein has been isolated from fat that's in milk, from lactose, which is milk sugar, and from the other vitamins and minerals that are in milk. Okay, so it's isolated from that. It's just basically pure protein. I mean, look at the protein concentration. It's 90 to 95%. Whey protein isolate, a lot of times, maybe if you're lactose intolerant, this would be the type of whey to consume if you're looking for a whey protein supplement. Generally, people that are lactose intolerant, they lack the enzyme lactase in the GI tract, so they have trouble breaking down lactose milk sugar, and obviously this causes GI distress, diarrhea, gas, bloating, things like that. But whey protein isolate is isolated from the lactose, so it's very low in lactose. Generally, if you're lactose intolerant, it's going to be okay for you to consume whey protein isolate. You'll probably do just fine with it, okay? Now, whey protein concentrate, this you see the percentage or proportion of whey protein is a little less, 25 to 89% compared to the isolate. And that is because whey protein concentrate also contains some fat from milk, some lactose and other minerals. So the protein concentration is a little bit less. And if you look back at whey protein isolate, higher amount of protein concentration, there's obviously less of the other components, okay? Now, whey protein concentrate, if you are lactose intolerant, this may cause some issues because, again, there's going to be more lactose in it, so you may want to stay away from the concentrated form. Now, hydrolyzed whey, this is where, again, pretty high in the amount of whey protein there. There's more variable concentration there of the other components. May have an issue if you're lactose intolerant with that version. In the hydrolyzed whey, what they've done is they've chemically kind of with enzymes chopped the whey protein apart into smaller peptides. So that's what we mean by hydrolysis or hydrolyzed whey there. So let's compare whey versus casein. Okay, both whey and casein, both of these supplemental forms of these dairy proteins can elicit protein synthesis. One of the main differences between whey and casein is that whey is very rapidly digested and absorbed. Okay, so within 20 to 30 minutes, you consume a whey protein shake. Amino acids are going to start rising in the blood very quickly, and obviously moving towards, maybe those muscle cells that you just trained, in a rapid manner, which is going to be great after workout because that's going to help with the repair and rebuilding of that muscle tissue. Casein is slower digesting. It kind of, when it hits the stomach, clumps up in that acidic environment, kind of forms this gloop or globules. And as a result of it kind of clumping in the stomach, it's more slowly released once it enters the small intestine. From the small intestine, the amino acids are going to be more slowly released over time and absorbed into the bloodstream. So you don't get as big of an acute spike in amino acid levels in the blood with casein consumption as you do with whey. All right, so whey is great for use post-workout. Studies have shown whey protein is more effective at eliciting muscle protein synthesis immediately after exercise than casein. Casein, however, is great for use in the hours before a workout, bedtime, or during periods between meals, maybe when you're not eating, due to its slow digesting compounds and ability to keep people satiated. And it just kind of keeps a steady supply of amino acids going into the blood, it's great before bed because you may sleep 8 hours, and you're obviously not eating, so the casein can supply a steady stream of amino acids from the GI tract into the bloodstream while you're sleeping, which could help aid with muscle protein synthesis and repair overnight. Whey is great to use within recipes to increase protein content. You can also use casein in recipes as well. So the conclusion there, both whey and casein can be added to your supplementation regime to elicit around-the-clock protein synthesis and help you meet your protein daily intake requirements. And they can even be taken together. These two graphs here from a study by Tang and colleagues in 2009 are showing whey versus casein absorption. Soy is also listed there, the dashed line with the triangles. But you see whey is the dashed line with the open squares. Casein is the solid line with the circles. And if we look at essential amino acid concentration, that's in nanomoles per milliliter of blood. So here we're looking at the absorption, the concentration of amino acids in the blood over time after the ingestion of either a whey protein supplement, soy, or casein. And you look at whey, as I mentioned previously, you see a very high level of essential amino acids appearing in the blood 30 minutes after a whey protein supplement is consumed. Soy is kind of in the middle there at 30 minutes, and then casein is lower. Okay, and you see how that casein, the level of amino acids in the blood, kind of remains steady over time as you go out to 60 minutes, 90 minutes, 120 minutes post-absorption. Whey is still pretty elevated. The amino acids coming from the whey protein supplement at 60 minutes, significantly elevated, and then it drops back down at 90 minutes because at that time point, most of the amino acids from the whey protein supplement have left the bloodstream and have been uptaken by your cells. And of course, when those amino acids enter the cells, they're in what's called an amino acid pool, and depending on the needs of the cell, those amino acids may be incorporated and put together to build a protein in that cell. And then you look at, on the right, leucine. So leucine, again, is critical for stimulating muscle protein synthesis and growth because it activates mTOR in your cells, and mTOR is the master regulator of muscle protein synthesis. It switches on various translation initiation factors and enzymes that are needed and that direct the ribosomes in your cells to build proteins. So leucine is high in whey, and you look at the leucine content in nanomoles per milliliter of blood there at 30 minutes after consumption of whey protein, you see that big spike in leucine. It's still elevated at 60 minutes, as indicated by the asterisks next to those square boxes, and then it starts to come back down at 90 minutes, which is following a similar profile as to all the other essential amino acids on the graph on the left. So again, you get this nice spike in leucine with whey protein supplementation, a greater spike than you see with soy or casein, and that leucine can really help to trigger muscle protein synthesis within that 30-minute to 60-minute time frame after consuming a whey protein isolate shake. And this just shows the essential amino acid and leucine content of different protein sources. So if we look there at the percent of essential amino acid and leucine content there on the y-axis, you see the animal sources. Whey, of course, we just discussed, that's high in essential amino acids and leucine. Milk, casein, beef, egg, fish, they're all great. In the green there, plant sources. What do you have going from high to low? Lentils, quinoa, beans, maize, soy, they're a little bit higher. And then at the very far end, you see wheat is lower in the essential amino acids and lowest in leucine content. So the effectiveness of protein sources is partly dependent on amino acid composition, especially the essential amino acids, and in particular, leucine. So soy protein. So this is a kind of unusual plant-based protein in that it has the full complement of essential amino acids, and it is of high overall quality compared to other plant-based proteins. So soy is a great protein for vegan athletes that are choosing not to, consume any animal products, maybe for ethical reasons or just maybe they're doing it for health reasons. And those with dairy allergies, so maybe those that, have are allergic to certain milk proteins or that are lactose intolerant. So soy contains phytoestrogen, which may exhibit estrogen-like properties in the human body. It could be problematic if it caused a decrease in testosterone levels in males. However, a published meta-analysis has shown that there's no negative hormonal effect on men supplementing with soy. You would have to consume a lot of soy protein for there to have any, real estrogenic signaling in the body and any significant decrease in testosterone levels. So, if you're male, don't worry about, if you want to consume soy, it's going to be okay. Now, personally, I just like whey protein. That's what I utilize and rely on as far as a supplemental form of protein. But if you want to choose soy, you should be fine. And what's a meta-analysis, you might ask? That's where researchers look at kind of all the available studies in a particular area, on a particular topic. And, some studies, you may have, let's say, 20 studies. 15 may show one thing, another 5 show another. But you're trying to look at the weight of all these studies compiled together, and then you're running statistics on the sum of all these studies to kind of come up with an overall conclusion, okay, about what the sum of the evidence, in this case in soy protein, well, what's the sum of the evidence show? So that's what a meta-analysis is. All right, so in this meta-analysis, now that you understand what that is, the title here, Clinical Studies Show No Effects of Soy Protein or Isoflavones on Reproductive Hormones in Men. So you look at the conclusions there. The results of this meta-analysis, where they've looked at many, many studies on soy protein, soy food supplementation, suggest that neither soy foods nor isoflavone supplements alter measures of bioavailable, so free testosterone concentrations in men. Okay, so again, the objective of the study, they were just trying to determine whether there was going to be any estrogen-like effects in men that consumed soy protein. Did it alter their free testosterone? And the answer was no, all right? So although soy does not possess the overall quality of animal-based protein, studies have shown no differences in strength or lean muscle mass when supplementing with soy versus protein derived from animals. So this study was published in 2020. The title there, No Significant Differences in Muscle Growth and Strength Development when Consuming Soy and Whey Protein Supplements that were matched for leucine content. Okay, so you had a group consuming soy, group consuming whey, but leucine was equal among the groups, following a 12-week resistance training program in men and women. So they also looked at both sexes, okay, which is interesting because I do think there's kind of a lack of research in exercise science and nutrition in women. So the bottom line conclusion here, you see highlighted in yellow, these data indicate that increases in lean mass and strength in untrained participants are comparable when strength training and supplementing with soy or whey protein are matched for leucine. Okay, so they took untrained participants, they had them trained for 12 weeks. The trained participants, if I remember correctly in this study, they had already been training, but they were following the same 12-week resistance training routine. And then at the end of this, basically lean mass and strength in the untrained participants, it was comparable no matter what supplement was used, soy or whey, as long as leucine was equal, it was held equal. All right, so talking about whole food proteins, the food matrix here. So research studies often use protein supplements for the sake of experimental control and practical convenience. So, anytime you're reading in the literature that, it was a resistance training study maybe, and then they gave them protein at different time points, they're typically giving them oftentimes whey protein, or, maybe it's casein, but a lot of times it's just a protein supplement. They're not using whole food, okay? However, the use of whole foods reflects a more common method of protein consumption, and I'm big on, supplements are supplements. They play a role, but if you can, get your protein by eating whole food throughout the day, every 4-5 hours, eat 4 to 5 meals a day. You're going to get adequate protein that way. And, if you miss a meal, or you're running short on time, or maybe it's you don't have time to make a meal and maybe make yourself some protein, utilize a shake, okay? So that's where the supplement comes into play to fill in the gaps of what you're not consuming from whole food. So research has identified that whole food sources may have different anabolic effects than those of their isolated components, and this may be due to just elements within the whole food matrix other than protein that may contribute to beneficial, anabolic biochemical effects on the body. So there's a study by Elliott and colleagues that found that whole milk consumption elicited a greater whole body protein synthesis response than skim milk when groups were matched for calories and protein content. So just kind of interesting there that the whole milk tended to be more anabolic than just the skim milk. So here, this study by Elliott, milk ingestion stimulates net muscle protein synthesis following resistance exercise. If you look at the bottom line conclusions of this study, ingestion of milk following resistance exercise results in phenylalanine and threonine, those are amino acids, uptake, representative of net muscle protein synthesis. So I think I'd have to go back and read through the study design here. But a lot of times when they are assessing protein synthesis, tracers will be used, and they can trace how amino acids go through the body. So they may add like a neutron to the amino acid, and they can trace it and see where it gets integrated into a muscle protein, and then you can calculate muscle protein synthesis based off of where these traces are going. But anyway, these results suggest that whole milk may have increased utilization of available amino acids for protein synthesis. And again, I'm a big advocate, milk is a complete protein. You're getting all your essential amino acids. It's quick and easy to consume, after a workout. Oftentimes I'll stop if I do a training session and I know I'm not going to eat for a while. I'll just stop in at Quick Trip or a convenience store and pick up some chocolate milk, and bam, I've got a good complete source of protein there to help really stimulate muscle protein synthesis after that training session. Okay, quick and easy. So a study by Van Vliet and colleagues found that whole egg consumption increased muscle protein synthesis to a greater extent than the consumption of an identical dose of just egg white, right? So here in this study by Van Vliet, looking at consumption of whole eggs and promoting greater stimulation of post-exercise muscle protein synthesis, if we read the conclusions, they showed that the ingestion of whole eggs immediately after resistance exercise resulted in greater stimulation of myofibrillar protein synthesis. So that's myofibrillar, means that's the actin and myosin proteins inside muscle cells that are responsible for producing force and contraction. And those myofibrillar proteins, actin and myosin, if you're synthesizing more of those and packing more in a muscle fiber, generally that leads to the muscle fiber getting larger and stronger. And if that's happening in all the muscle fibers in a whole muscle, well, then that whole muscle group can get bigger. That's where you have, if muscle fibers are getting bigger, hypertrophy. So again, the whole eggs after resistance exercise resulted in greater stimulation of those myofibrillar proteins, the synthesis of those, than did the ingestion of just egg whites, despite being matched for protein content in young men. So they consumed an equal amount of protein in the egg white group or the whole eggs, but there's a difference going on here. There's other components that are in whole eggs compared to just the egg whites that allowed for greater stimulation of muscle protein synthesis. So our data indicate that the ingestion of nutrient and protein-dense foods differentially stimulates muscle anabolism, or, muscle protein synthesis, muscle building, compared with protein-dense foods. So again, this is a benefit of consuming this whole food source, in this case, whole eggs versus just egg white. And again, thanks for watching this edition of Fitness Facts. I hope this breakdown of these different food sources, different supplement sources of protein is of benefit to you.